Interocclusal records. This video will review the step-by-step process for capturing accurate Dentka records. The first step involves cutting the posterior sections off the impressions. The impressions can then be reseated to record vertical dimension of occlusion and centric relation. Cutting a portion of an accurate impression can be a challenging concept to comprehend. This is a critical step, however, as it allows for the repositioning of the tray in order to capture records without interference. One may choose to become more familiar with the trays by gently removing the posterior sections of an extra tray before attempting to separate your final impression. To make the process easier, one may identify the lines on the side where the tray separates and mark these with a magic marker to guide the cuts. This is a useful tip as the impression material will be covering most of the tray when it is time to section. It is important to make one clean cut with the scalpel blade when sectioning the impression. Stopping and starting or removing the blade may ultimately affect accuracy in the scanning process. Also, one must be gentle when separating the impression. Being too aggressive or forceful can break the tabs off the tray, which can again negatively affect the scanning process. When cutting the impression, first identify on the side where the tray separates. The separating area on the impression surface will again not be visible through the impression material. The clinician may elect to draw a line with a marker before cutting to simplify this process. When starting the cut, push the blade all the way through the material until the tray is felt. This can be likened to the tactile feeling of when incising soft tissue to the bone to reflect a soft tissue flap. Upon hitting the tray, continue straight across to the other side. Do not release pressure or remove the blade during the process. Once across to the other side, gently wiggle the tray to separate the end, with care not to break the tabs. Oftentimes, there will be too much impression material in the tray to fully seat the pin assembly on the lower tray. Carefully remove as much material as needed to fully engage the pin into the clips. The rounded end of the pin should be facing away from the impression material. Follow the same steps as the upper when cutting the lower tray. Identify the starting point on one side, engage the blade down to the tray, and go completely across to the other side in one pass. The posterior sections do not need to be reattached to the rest of the impression. Dentka will do that before scanning. It is important, however, to make sure that the posterior portions of the impressions are not thrown away. Keep them together in a safe place after separating. It is critical that Dentka has these portions to fabricate the final denture. The next step is capturing vertical dimension of occlusion, or VDO, and centric relation, or CR. Since the posterior sections were removed, the trays can now be reseated fully without interference. The pin on the lower tray rotates to open and close the VDO. Rotate as necessary until the ideal VDO is reached. This VDO was established with pre-treatment records. Once the VDO has been established, before proceeding with CR records, make sure the upper and lower trays are not touching in the back. If they are in contact, the pin must be raised to prevent interference, which will result in an inaccurate CR. Simply let Dentka know how much the pin was raised on the order form, and they will compensate by closing the bite down in the final dentures. This can be an elusive position for many patients. For all intents and purposes, complete dentures are a full mouth rehabilitation. When there are no teeth or stable contacts for guidance, one of the only reliable, repeatable positions is centric relation. For many years, Gothic arch tracers have been used to accurately capture CR. These are comprised of a central bearing pin and a striking plate. This technique is predictable and reliable, but does require some practice and a lab that knows how to work with them. Fortunately, Dentka has simplified the Gothic arch tracer and has built it into its trays. The Easy Tracer further simplifies the CR process. Before placing the Easy Tracer, clean the striking plate area with an alcohol and dry thoroughly. Peel the sticky backing from the Easy Tracer and apply it to the striking plate. Easy Tracer has a film that peels back, so the tracing can be cleared and repeated as many times as needed. With the Easy Tracer now in place, reinsert the upper and lower trays. Have the patient gently touch the lower pin to the upper plate, then move forward, backward, left, and right slowly and repeat a few times. If done correctly, you will see a clearly defined arrow. If yours does not look like an arrow, peel back the film and repeat. If the patient bites hard instead of gently touching, the trays will move, resulting in an inaccurate record. When capturing CR is complete, make a small divot with a number 4 round burr at the point of the arrow, which is your CR. It may be easier to see the arrow on the dark layer underneath the film. This divot will provide a stopping point for your patient to catch their CR as you record with bite registration paste. Help guide the patient back to CR and gently close with a light touch of the trays in the CR position as the pin catches the divot. Again, a light touch is critical, as too much pressure will cause tray shifting and an inaccurate final denture. Stabilize the patient's mandible while the bite registration paste sets up so that the patient doesn't slide out of the divot and lose their CR. Most commonly, the patient will slide forward out of centric relation. An inaccurate recording will likely result in an anterior open bite or require significant occlusal adjustment at delivery or try-in. Stabilize the lower tray with a thumb in the patient's mouth while stabilizing the patient's chin with the fingers. This helps prevent the lower tray from tilting and the mandible from moving. Remove the entire record from the patient's mouth and examine to make sure the pin has engaged the divot and that the trays are not touching in the back. Once this has been approved, send to Dentka along with the cut ends of the impression. Upon receipt, Dentka will scan and digitize the impressions. Once scanned, the Dentka software will identify more than 26 anatomic landmarks on the impressions. This information is inputted into an algorithm used to determine the ideal design and setup for each patient, including tooth selection, midline, occlusal plane, curve of Spee, curve of Wilson, articulation, and post-stem. At this point, a prototype of the designed denture will be printed with a 3D printer. This can be used for try-in or directly converted to the final denture, depending on the clinician's preference.